All right, so Chapter 14, Biostatistics. Purpose of biostatistics. Statistics involves the collection and analysis of all types of data, from the average numbers of cars on a freeway to the blood pressure reduction that would be expected from, say, a calcium channel blocker. When statistics are used to understand the effects of a drug or medical procedure on people and animals, the statistical analysis is called biostatistical analysis, or simply biostatistics. A basic understanding of biostatistics is obviously required to interpret studies in medical and pharmacy journals, such as when looking at the New England Journal of Medicine or the Pharmacotherapy Journal. Simple formulas and definitions described here prepare the reader to interpret most journal articles and feel confident tackling common practice-based situations, such as maybe a physician when you're doing a residency asks if a patient should be switched from standard of care treatment to a new drug based on the relative risk reduction that was reported in a clinical trial that they recently explored. And then maybe another situation, a patient is taking warfarin and they want to know if they should switch to Xarelto because the patient saw a commercial claiming that it, quote, prevents DVT or PE in 98% of patients, end quote. So let's review what are the steps that are required in order to publish in a journal. So the path to publication for the classic type of research study is shown in the figure on the next page. A study manuscript, which is the description of the research with the results, can be submitted for publication in a professional peer-reviewed journal. The editor of the journal selects potential publications and sends them to experts in the topic area for peer review. Peer review is intended to assess the research design and the methods, the value of the results and conclusions to the field of study, how well the manuscript is written, and whether or not it is appropriate for the readership of the journal. The reviewers make a recommendation to the editor to either accept the article, and this is often done with revisions, or if they are going to reject this article. Data that contradicts a previous recommendation or presents new information can change treatment guidelines. All right, so let's look at organization of the published clinical trial. So a published clinical trial begins with an abstract that provides a brief summary of the article. The introduction to the study will come next, which includes background information such as disease history, prevalence, and the research hypothesis. This is followed by the study methods, which describe the variables and the outcomes, and the statistical methods which were used to analyze the data. The results section will include figures, tables, and graphs. A reader needs to interpret basic statistics and common graphs in order to understand the results of the study. The researchers conclude the article with an interpretation of the results and the implications for current practice. All right, so let's look at the types of study data that'll be collected. So when data points or values are collected during a study, They can be analyzed to determine the degree of difference between groups or some other types of association. The statistical tests used to perform the analysis depend on the type of data. So you could have continuous data. Continuous data has a logical order with values that continuously increase or decrease by the same amount. So for example, a heart rate of 120 beats per minute is twice as fast as a heart rate of 60 beats per minute. The two types of continuous data are interval data and ratio data. The difference between them is that interval data has no meaningful zero. So 0 does not equal none. And then ratio data has a meaningful 0, where 0 equals none. The Celsius temperature scale is an example of interval data because it has no meaningful 0. So 0 degrees Celsius does not mean no temperature. It is just the freezing point of water. Heart rate is an example of ratio data. A heart rate of 0 beats per minute is cardiac arrest. So therefore 0 equals none, where that means that the heart is not beating. So you could also have categorical data or discrete data. So the two types of discrete data are nominal and ordinal, and have categories, are sometimes called, again, categorical data. So nominal and name are derived from the same word. So with nominal data, subjects are sorted into arbitrary categories or names, such as male or female. Maybe in one study, male equals 0 and female equals 1. And in another study, female equals 0 and male equals 1. It is sometimes described as yes and no data. Ordinal data is different than nominal data. So ordinal data comes from the word order. Ordinal data is thereby ranked and has a logical order. Such as, think about a pain scale. In contrast to continuous data, which we already talked about, ordinal scale categories do not increase by the same amount. So like a pain scale rating of 4 is worse than a pain scale rating of 2. But it does not mean that there is twice as much pain. So then let's look at summarizing the data. So measures of central tendency. Descriptive statistics provide simple summaries of the data. The typical descriptive values are called the measures of central tendency and include the mean, the median, and the mode. Again, the mean is the average value, which is calculated by adding up all the values, dividing by the total number. The mean is preferred when you're looking at continuous data that has a normal distribution. The median is the value that's in the middle, when the values are arranged from low to high, for example. When there are two center values, as with an even number of values, then you would take the average of the two center values or middle values. The median is preferred the middle, again, or median, is preferred when you're looking at ordinal data or continuous data that is skewed and not normally distributed. Mode is the value that occurs most frequently, and the mode is preferred when you're looking at nominal data. So let's review the variability of data, or the spread. So two common methods of describing the variability or spread in data are the range and the standard deviation. So range is the difference between the highest and the lowest values. The standard deviation, or SD, indicates how spread out the data is and to what degree the data is dispersed away from the average or the mean. For example, spread out over a smaller or a larger range. A large number of data values close to the average or the mean would have a smaller standard deviation, whereas data that is highly dispersed would have a larger standard deviation. All right, so let's see. The next one we're going to review is the normal distribution. So large sample sets of continuous data tend to form a normal or bell-shaped distribution. For example, if a researcher collects 5,000 blood pressure measurements or continuous data from Idaho residents and plots the values, the graph would form a normal distribution. When the distribution of data is normal, the curve is symmetrical, even on both sides, with most of the values closer to the middle. Half of the values are on the left side of the curve and half of the values are on the right side. A small number of values are in the tails. When data is normally distributed, the mean, the median, and the mode are the same value and are at the center point of the curve. 68% of the values fall within one standard deviation of the mean, and 95% of the values fall within 2 standard deviations of the mean. So let's review some of the shapes, the normal distribution shapes. So we have some examples here on our chart, page 204. So these examples to the right show how the curve of normally distributed data changes based on the spread or the range of the data. The curve gets taller and skinnier as the range of data narrows. The curve gets shorter and wider as the range of data widens or is more spread out. So then we can have some skewed distributions. So data that are skewed do not have the characteristics of a normal distribution. The curve is not symmetrical. 68% of the values do not fall within one standard deviation from the mean or the average, and the mean, median, and mode are not the same value. This usually occurs when the number of values or the sample size is small, or there might be some outliers in our data. So outliers are also known as extreme values. So an outlier is an extreme value, either very low or very high compared to the norm. So here's an example, page 205. If a study reports the mean weight of included adult patients as 90 kilograms, then a patient in the same study with a weight of 40 kilograms or 186 kilograms, those would be considered outside our normal, or they would be outliers, or considered extreme for that particular study. When there are a small number of values, an outlier has a large impact on the mean or average, and the data will become skewed. In this case, the median is a better measure of central tendency. In the examples we have on the right on page 205, the median, or the middle. So in the example here on the right, the median or middle value is right in the middle of the data and is not affected by the outliers. The distortion of the central tendency caused by outliers is decreased by collecting more values. As the number of values collected increases, the effect of outliers on the meaning the middle value, the effect of those outliers will then decrease. Skew refers to the direction of the tail. So data is skewed towards outliers when there are more low values in a data set and the outliers are the high values. Data is skewed to the right, or a positive skew. When there are more high values in the data set and the outliers are the low values, then the data is skewed to the left, which is a negative skew. All right, so let's move into the section on dependent and independent variables next, and testing for hypothesis.